What's up, guys? It's Josie. And today, I'd like to take you on a journey that challenges our understanding of the COVID-19 pandemic. In this eye-opening video, we'll take a deep dive into Mark Rubio's A Complex and Grave Situation, where we'll examine the virus's upbringing, the impact on the US economy, and global responses towards the virus. Prompting the question, are the origins of COVID true according to the media? Or is COVID-19 an unintended consequence of scientific research? First, let's talk about how it affected us.
Tonight, the ongoing challenge for schools to remain open as rising COVID numbers force some to shut down and go virtual.
Where did COVID come from?
It comes from China. That's why. It comes from China.
I personally experienced this outbreak while still attending high school. And for those of you who are still in school, I'm sure you remember the supposed 2-week cancellation turning into a year-long event. These consequences not only appeared in our education, but also involved an increase in unemployment, contraction of our economy, government interventions, and an overall shift in the way we interact with each other. Now that we have some sort of background, let's delve into Mark Rubio's political chronology of the SARS-CoV-2 outbreak. Before we talk about anything else, let's start with the mandatory state secret training for researchers. On May 10th, Zhao Gangfu, the CCP party secretary at the Wuhan Institute of Virology, also known as the WIV, mandated a training session for all research personnel, postdocs, and graduate students on protecting state secrets. They were required to pledge confidentiality regarding their research at the WIV. Tang Kai-hong, an official from China's National Administration for the Protection of State Secrets, spoke on the national security risks tied to the institute's research and the threat of foreign espionage, according to a report from the WIV's parent organization, the Chinese Academy of Sciences, also known as the CAS. The WIV later released a report on the training. However, the publication date was inconsistent, indicating possible alignment with a significant biosafety incident. Tang's comments emphasized the state-controlled nature of the WIV and the Chinese Communist Party intent to keep the WIV's work concealed from the international community. Now that you know of the secretive gatekeeping of such information, let's delve into the problem of the Level 4 Chinese Biosecurity Labs, also known as BSL-4. On July 16, 2019, the WIV posted their third notice of the year on the official procurement of the PRC central government. This notice was all about renovation or maintenance work for its lab facilities, specifically concerning the hazardous waste treatment system at the BSL-4 lab in the Zhengdian Park campus. Now it's unclear when exactly this lab became operational, but it's likely that it was within a year or two before this tender was issued, suggesting that a significant overhaul was necessary. A contractor was selected by the end of July with a budget of about $147,319. It's possible this project was part of an upgrade plan discussed back in April 2019 with senior CAS officials from Beijing. Also, in July, a political studies session held at the WIV pointed towards biosafety issues within the same BSL-4 laboratory. This wasn't just a minor meeting either. The party members in attendance offered their thoughts on improving biosafety theory and technological training, management of hidden safety risks, sharing of high-precision instruments, and the overall moving process to the Zhengdian lab. It seems like there were real concerns here, and this wasn't the first time these issues were brought up. On July 8, 2019, Xiao Gangfu raised similar concerns about the professional management quality at the WIV. His deputy, He Cheng-kai, echoed these sentiments, urging managers to shoulder responsibility, dare to face challenges, and work on self-improvement. In pages 84 to 101 in Senator Mark Rubio's report of the COVID outbreak, described what seemed like a hollow bid to improve the standards of scientific practices. He Cheng-kai hosted a meeting where he prodded the middle management of the Wuhan Institute of Virology to enhance their capabilities. Despite his emphasis on ongoing learning, persistence, and a scientific approach to problem solving, his insistence on executing tasks to completion came across as mere rhetoric rather than genuine guidance. Following these platitudes, on July 18th, the WIV declared on China's official procurement site its intention to procure an ambient air disinfection treatment system and a scalable automated virus sample storage management system. Ostensibly for the Shenzhen campus, the chosen contractor was hastily decided upon by August 14th, with a winning bid of approximately 1.27 million US dollars. This shows the CCP's awareness of the virus and lying out of fear, contracting the installment of these systems to keep the CCP party leaders at ease. Merely a week later, the WIV proclaimed advancements in biosecurity. A comprehensive cooperation agreement was signed with the Hubei International Travel Healthcare Center, supervised by the National Entry-Exit Inspection and Quarantine Bureau of the PRC General Administration of Customs. This so-called agreement aimed at ensuring biosafety during the 2019 Wuhan Military World Games. Yet, it raised questions about the timing and the sudden interest in biosecurity measures. In August 2019, Wang Xiaoli and Tang Hong from the CAS Institute Pasteur of Shanghai penned an article pressing the importance of science and technology in managing infectious diseases. Meanwhile, Wu Guishen, a so-called biosafety expert at the CCDCP, highlighted considerable regulatory concerns in China's biosafety practices. But the actions taken was just for show, and their warnings were severely ignored. By September, a troubling change swept across the WIV. They began limiting transparency and collaboration with international scientists while ramping up security. In a contentious move, the WIV pulled its wildlife-borne viral pathogen database offline. This essential resource, previously available to the researchers globally, was made sporadically accessible from December 2019 to February 2020, but it was completely withdrawn following the allegations linking the WIV to the SARS-CoV-2 outbreak. The esteemed director of this said database, Shi Zhengli, casually brushed off the sudden removal of the database, attributing it to an innocuous response to purported security concerns and alleged hacking attempts. Her explanation seemed to construct a veil of obscurity around the actual events, cleverly attempting to divert scrutiny. However, the reality of the situation paints a more complex and intriguing picture. The Wuhan Institute of Virology, it appears, had been harboring doubts about a possible leak of the notorious SARS-CoV-2 virus, the very pathogen responsible for the global COVID-19 pandemic. The Chinese authorities, unfortunately, struggled to efficiently track and contain this emergent virus. The rather abrupt decision to take the database offline can be interpreted as a desperate attempt to curb the flow of information and to prevent the potential leak from spiraling into public knowledge. The actions of the Chinese Communist Party following these events cast a murky shadow over the unfolding narrative. The CCP allegedly engaged in an extensive campaign to obscure the truth, utilizing a strategy of deception and misdirection to manipulate the global perception of the situation. This intricate web of obscurity, reportedly spun by the CCP, ultimately served to shroud the truth, casting doubt and confusion about the origins and early management of the COVID-19 pandemic. Let's move on to the puzzling case of a man in Wuhan who began showing symptoms of COVID-19 on December 1st. Interestingly, he was linked by PRC authorities to the Hunan seafood market, which was initially pinpointed as the source of the outbreak. His wife, with no known exposure to the market, developed pneumonia and was hospitalized 5 days later. On December 10th, 3 more patients developed symptoms, 2 of whom had no exposure to the market whatsoever, hinting at a possible person-to-person transmission. Even more intriguing was an analysis of officially reported cases from December 2019 that indicated only 66% could be directly linked to the market, implying a not so small 34% of cases unrelated to the market. Despite these emerging pieces of the puzzle, Chinese authorities announced that the outbreak on December 31st, conveniently withholding information about person-to-person transmission until January 20th. By then, numerous health professionals who might have tried to share information about the novel coronavirus's transmissibility had already paid a high price for revealing details about the outbreak without state authorization. All these secretive practices are what we've come to expect from China's political leadership, who often guide public opinion through censorship and control over the content and flow of public information. A veteran reporter from the South China Morning Post has raised concerns about hidden official government data, revealing that the earliest confirmed case of COVID-19 was a 55-year-old individual from Hubei province. This person became the first confirmed case of the virus on November 17th. Although this was the first confirmed case, he may not actually have been patient 0, as the real one would have been prior to November. The SEMP revealed that from that day, daily cases ranged from 1 to 5, and by December 15th, there were 27 infections, rising to 60 by December 20th. Let's not forget the little gem they dropped in March 2020. Chinese authorities had identified a noteworthy 266 people infected in 2019 who were under medical surveillance. Quite the contrast to the PRC's report of only 174 cases to the World Health Organization. Still, in November, we learned of Connor Reed, a young Welshman teaching English in Wuhan, who fell ill with flu-like symptoms. After an initial recovery, he developed severe pneumonia on December 6th, necessitating hospital care. The hospital would only confirm on January 16, 2020, that he was infected with the novel coronavirus. An innocent victim, or a data point conveniently overlooked? Early January saw a series of phone calls between 2 high-ranking individuals in the world of epidemiology. George Fu Gao, the Director General of the China CDC, and his American counterpart, Dr. Robert Redfield, the Director of the U.S. Centers for Disease Control and Prevention. On January 4th, the usually composed Gao became distraught and started crying after finding a lot of cases among individuals who had not been to the wet market, according to Redfield's account to CNN. It appears that the Chinese authorities were not transparent with their information sharing, even with their foremost infectious disease expert. The real magnitude and severity of the outbreak weren't entirely clear to Gao until these early January days. Despite this revelation and feeling overwhelmed, Gao shunned Redfield's offers to dispatch U.S. experts to provide technical assistance to combat the outbreak. His reason? He did not have the authority to accept Redfield's offer, and the CCP leaders who could accept it were, rather predictably, unwilling to do so. Gao's acknowledgement on January 4th of many cases that couldn't be traced back to the Hunan seafood market implies that central government officials were well aware of the high probability of lab leak long before they decided to alert the public of the risks. Just another example of their political cover-ups. In December, we see the entirety of Wuhan high schools closing classes due to a severe influenza outbreak, the start of what we now understand as COVID-19. The city of Xianing, some 60 miles south of Wuhan, saw 20 times the normal rate of flu cases. Wuhan itself was declared the 3rd worst infected city within the province. Yet, many of these flu cases were labeled as an unknown cause. Mysterious, isn't it? By January 18th, officials in Wuhan allowed a large Lunar New Year banquet in the Baipuqing community. But here's the kicker. They didn't bother informing residents about the risk of the novel coronavirus. It's estimated around 40,000 families participated in this celebration. Only 2 days later, central authorities publicly recognized person-to-person transmission of the virus. Meanwhile, a US diplomat recalled that local authorities closed public schools in December 2019, 2 weeks before publicly acknowledging an outbreak. They were quick to forward this information to Embassy Beijing, keeping the possibility of a viral outbreak on their radar. Their assumption was any new virus would likely emerge in rural areas before spreading to urban centers across China. Lastly, let's not forget the compelling revelation by Yu Chunhua, a professor of biostatistics at Wuhan University. He divulged that he compiled a nationwide database of COVID-19 cases, some dating back to as early as September 2019. He identified 2 confirmed patients with symptom onset between November 14th through the 21st, 2019, and another patient who fell ill in late November and was hospitalized with pneumonia on December 2nd. To all the people in our country that still believe that the origin of the COVID-19 virus was originated from bats, it's crucial to note that the majority of bat species known to carry viruses are predominantly found in southern China, near the country's southern borders. Contrastingly, Wuhan, the epicenter of the outbreak, is situated in central China. This geographical discrepancy is similar to suggesting that a virus related to alligators could spontaneously emerge in Colorado, despite the fact that the majority of alligators are found in states like Florida, which is on the opposite side of the country. As we reflect on the trajectory of the COVID-19 pandemic, it is becoming quite clear that the virus was the result of a lab leak caused by inadequate maintenance and operations at the WIV. This state-run Chinese lab is known to house an astonishing 15,000 coronavirus samples. Given the sheer volume of samples in their research for weaponization and modification of viruses within such a facility, the bat origin theory seems less likely and more absurd. Senator Rubio's comprehensive political chronology provides a compelling narrative, backed by over 80 English and Chinese sources. It meticulously traces the Chinese government's handling of biosecurity, biosafety, and public health matters from 2018 to 2021. It also sheds light on the alleged cover-up of the deadly disease before it spread across the globe, causing unprecedented devastation. The COVID-19 pandemic has claimed millions of lives worldwide, instigated lockdowns, sparked riots, and severely disrupted our global economy and supply chains. As we continue to grapple with the repercussions, it's crucial to understand the origins of the virus, not to assign blame, but to prevent future pandemics and ensure the safety of humanity. As we're wrapping up this video, it is important to know that in no way does this cover the entirety of the 329 pages of the political chronology. But we've worked hard to go through all the information to lay out all the evidence in a chronological order for viewers out there to learn of this new finding. And because of this, we've tried our best to eliminate the report's bias as well as our own personal interpretation bias, to present you all with a logical and sensible picture of how the origins of this global pandemic started from the very beginning. Now, it is up to every single one of you to connect the dots and form your own understanding. Thank you all for watching. Please like and subscribe. If you all would like to learn more of this document, please click the link in the description below. And until then, Jussi, out!